So, hello all. I'm Dr. Dheeraj Masappu. I'm the faculty of Anesthesiology Residency Program in Marrow, super specialty category, and I have taken care of the neuroanesthesiology and neurointensive care division in that. And we have Dr. Ajay Ashok with us, who secured rank 13 in the recent NEET super specialty examinations in the anesthesiology group. Congratulations, Dr. Ajay.
Thank you so much, sir. It's an honor. Thanks.
So I would like to ask you a question. So now your rank is 13, and then you'll have a wide variety of options in DMs and DRNBs in good institutes, government hospitals, and then private medical colleges, and then you'll have superb corporate hospitals to choose, because you can mostly I think you will get whatever you want. So you have cardiac anesthesia, you have neuro anesthesia, you have pediatric anesthesia DMs, you have regional. So many DMs and DRNBs are there. So even other than critical care, everything else would be there in this particular section. So what are you going to choose now, and what made you interested in that particular area?
So I did my MD from Christian Medical College, Vellore. I was trained by the doyens of anesthesia, I believe, and a subject which really inspired me was pediatrics and neuroanesthesia. So, in a small stint of working outside Vellore, I do understand the need of neuroanesthetist, especially for the complex cases of aneurysm clippings or awake craniotomies, or when we really have bad items which require SSEPs and MEP monitoring, and to help them reach the right planes, especially in resource limited settings where you really don't have all the monitors that you probably have back at Vellore. So that probably gave an impetus that I probably must do my DM in Neuro, which has a good deal of peds also along with it. So that is the reason why I would want to take up neuroanesthesia as my specialty and take it forward from there.
So congratulations and welcome to neuroanesthesiology then. And
Thanks
join our fraternity and our societies, and we want you to, take neuroanesthesiology more by doing research and everything in the field in future. So then, so since you got rank 13 now, you'll have different options now. Different colleges would be there, both in DM and DRNB. So between DM and DRNB, what are you actually choosing to take?
I know it's too early for me to speak about what I will get. That depends on people above me, but still, I would prefer taking my DM, and I would prefer going back to the institute that trained me. I really miss my institute, so I really want to go back to pursue my DM back there.
Wow. So you already decided, and then hope your wish will be fulfilled. And considering rank, considering rank 13, I think 95 to 98% you would get that. So because since only 2 seats are there in CMC Vellore in DM category, so there will be some element of competition, but above 90% chances are there for you to get into that particular college. So then but there is a bond, right, for DM. That is one worrying thing with the DM program at present.
Yes, Vellore comes with a bond of 2 years. Yeah, it does have a bond. We did have a bond after our MD also. So, yeah, we do have a bond.
But you're okay with that?
I am, sir. Yeah.
Because so your course will be 5 years. It's not 3 years course.
But it's an honor to work with them. So
yeah, I can understand. So you can actually take up large scale projects, actually. Well, I mean, in a research, since you stay there for 5 years in a high volume center and, very niche area you're working, you can take up good areas and you can plan actually. Since when I was doing my DM, even I felt, and the third year ending, when I was about to leave DM, I was actually thinking I should have stayed for 1 or 2 years more is what I actually felt. So many people would think that DM is an overkill. Another 3 years, who will study here is what people would think. I actually I thought opposite that time. In 2016, I wrote my exam. 13 I joined, and 16 I finished. So in 16 I thought maybe 1 or 2 years I should stay here to some more season my skills. Is what I thought, but that later happened in the corporate hospital where I joined. So, but still, this is a good thing actually. I think 3 to 5 years you should invest in a place like CMC Vellore. So now we'll come to another area. So how did Marrow, so our Marrow Super Specialty Residency Program help you in anesthesia in
I
getting this
joined
particular?
the Marrow SS program at the very beginning itself when it just had started. So when there was only these topic by topic that was getting added, starting from Dr. Arun's videos and then forward from there. It's a very vast specialty, sir. I think anesthesia is one of the most underrated specialties in the world possible. At least in India, it is underrated because it's when we start reading, we understand it's an ocean which you really can't pass because it starts from medicine, goes into physiology, goes a lot into pharmacology. Only after you sail half the sea does anesthesia even start, and then the rest of the journey is turbulent waters forward. So I honestly believe that is a very underrated specialty per se. So we can't I did see a lot of my seniors' videos on various applications on YouTube where people would say we did Miller fully or we did Barash fully. And sometimes I really do understand that back doing MD at Vellore, you don't get the time to read a Miller fully or a Barash fully because you start your day probably at 6:45 in the morning and it ends probably about 8 or 9 in the night. And it's a tough long day, but that really helps because that's how they trained us. It's not just work, the ethics, the principles, the values, the whole thing of anesthesia being like this mother to take care of a patient in theater is something that Vellore taught us. But the drawback was you would never be able to read Miller from cover to cover or Barash from cover to cover. Marrow bridged that gap for a lot of those subjects, I would say. Like I have never read Miller cover to cover or Barash cover to cover. So then the whole thing is when I started off with the Marrow videos, I actually started off with the onco anesthesia part because I found it a different specialty which I probably never thought about that much. We never knew what the effect of propofol would be to the genes or dignocaine would be to the genes and how it would affect oncogenesis or anything like that. So I started off with the part which I was not very familiar with. I remember the CPET videos that Madam had covered in her onco anesthesia topics, which was quite exhaustive, but again helped a lot. Further from there to transplant, where videos were again a lot into the core physiology, and from there on to clinical care. Then to neuro, where we've been exposed to a lot of neuro in Vellore, but never to worry about how a TCD works or how an NIRS works in so much of detail, and then carrying on from there. Then each of the specialties, and obviously pediatrics, Dr. Neha's classes, which are very crisp, very clear, and very strict to say this is the thing that you need to cover. So similarly, every single faculty and obs also, I had nothing further to read for those subjects because the videos covered quite a bit. So the videos helped quite a lot because it helped to bridge the gap where there are some chapters where you wouldn't have covered the whole thing from a standard textbook. But yes, our faculty from Marrow have bridged that gap to help us cross the turbulent half sea that I was talking about. So I'm grateful to Marrow for that.
Wow. Great, actually. And one more thing, what I feel is even if you have a textbook or something, that particular topic, they would only be written by one author or some references they would do. And sometimes it is outdated. It's 4 or 5 years back written book, or some books are 10 years back and all that. But these videos are actually well researched. And then all the updated review articles and all we would have studied. And then all the latest research also we would have understood what latest technologies are in the market. And then so these are more updated, and it's a culmination of all the relevant content which is filtered and simplified and then given. So it will save time to the student, because 10 hours of work it would take for a student if he really needs to actually collect all these things, which would be given in 1 hour time. So 9 hours of time is saved for you.
A simple chapter like neuromuscular junction from Miller would definitely, for a first time reader, take roughly about 6 to 8 hours to really go into the proper understanding. So yes, sir, the videos from Marrow actually helped us bridge that gap. Lot of topics actually made easier. So that is something that Marrow really helped.
Superb. So then, so at what stage of MD training should somebody start seeing the videos, from the first year or second year or third year? What do you recommend, or after that?
Okay, I may be controversial in this, but still, MD period is very, very important to do our clinics right. So I think the biggest teacher is your patient, and the biggest resource is the theater. So I think, unlike a medicine person or a surgery person who probably the world knows that his world, the learning is through his patient. Here, it's a very subtle branch. It's out of the normal. So, my teachers in Velo used to say, the time you spin from your neck through a 360-degree, running from your heart rate to your SpO2 to your BP and down to your ventilator settings, down to the patient, go down to the field and sit, you should start the process again. This is how we were all taught. So I think the biggest tool is patient and care from the patient and learning from theater. But I would suggest that yes, starting early is always good. So start at the earliest that we can. If it is in the first year, start in the first year, and nothing gets added en block. So we keep adding it in phases. We don't. I think none of us understand the whole part of anesthesia in full because it's a subject in research. So I think even if it is a patient with a supratentorial mass, starting off with the physiology, starting off with how each inhalational agent affects it, then going on to the intravenous agents, adding on further from there to the anatomy, understanding what vessels are probably, I'm going to look at the monitor screen when the person is using a CUSA, and then trying to look at each of the problems. What reflects, why is there a brady, why is there a sudden brady that is happening in this patient, and then adding on knowledge through the years is the best way. So using Marrow from the very first year would actually help, but don't take it too harsh on yourself and add it in bits so that it really, you understand the whole thing by the end.
Super. So you recommend from the beginning?
Yes, sir.
So now I will ask you another controversial question. If you are not getting CMC Weller, then what will be your next option?
I haven't thought about it. I really probably should think about it. So I've really not thought about it, sir. I'm actually thinking whether to write my NESET or not.
Okay.
Because I am preparing, but I've not taken a call on that. So that totally depends. But I think it'll be wise for you to tell me better options or the more practical options also. So
the practical options, I think I should do a video in my channel in detail about all the colleges. What is the next in South India only? If you want to do it, actually DRNBs are also good if you really think about it. Jubilee Hills Apollo has DRNB, and Artemis, Gurgaon, and Medanta, and then I think and Apollo, Indraprastha Apollo is also very good. Paras also has, and so I think all these DRNBs are good. In DMs, other than CMC, what else actually in neuro is?
GP,
apart from the GP Pant.
Yeah, GP Pant. Yeah, there are
GP Pant is good. Again, it depends on how you utilize the 3 years matters basically. Like even if the resources were given, it doesn't mean that every student comes out in the same way. So looking at what you're telling the tumor, vessel, you'll identify with CUSA. So you are a man who will understand the details. You'll go into details actually. So any place would you will end up utilizing the place is what I feel. So
I think that credit goes to my teachers, sir. So that's how we taught. We used to be very clearly taught. So that credit goes to my teachers as well.
So then I think you have to name some of them so that you can give credit to them in the video, and all the audience will know their names also.
So it's a huge department. We have 76 teachers. So it's a very huge department.
Difficult, man. 76 names would be tough.
But
neuro team, you can tell.
The neuro team, definitely Dr. Georgine, Dr. Ramamani, Dr. Karen Ruby Lionel, Dr. Keta. These were four people who we fondly believe as four pillars when we get into the longest theater in the hospital. So it's definitely the longest theater that runs in the hospital. So starting at 6:45, you will find people like Rama ma'am walk into theater like a postgraduate standing at 7 o'clock and helping us load our own drugs. Back in Vellore, we load our own drugs. Everything is done by a postgraduate. You don't get a person to do things for you. So right from sticking the labels, the color coding to the labels, I think I should remember Dr. Sargent Philip George, one of my greatest mentors who taught anesthesia is not just a subject, it's an art, and it requires passion, wholehearted care for the patient. So I think one of my greatest mentors. Then definitely my support staff, my support teachers, Dr. Balaji, Dr. Ekta, and Dr. Anita. They were like these big support people who used to help us through tough times. But neuro, the four pillars they are like these the calmest souls. You'll find Rama ma'am teaching and going on and on and on with her classes, even when you know that, okay, what do I do next? They'll be there to calm you down. Dr. Karen is like a mother. I have nothing further to say. Dr. Georgine would give us all the confidence for our procedures. Like even when we are in first years, I know there are places where they'll not let you put a subclavian. They'll not let you here. They would stand behind, ask us our CBME lists, procedure-wise, order-wise, what is your checklist? Have you seen? What are you going to do? And then do. And then after the third, they would say, now you will do that. There's nothing further. Do it. And that's the kind of confidence that those four pillars, Dr. Rama, Georgine, Dr. Karen, and Dr. Keta gave. So greatly thankful to them. Yes, days in neuro are the longest. They are the toughest. We'll start the last craniotomy at 5 o'clock in the evening, and then you'll be like, okay, today is 9 or 10. So, but then that's the beauty of the subject, and that's the beauty of the place. So I'm thankful to all my teachers. I can't name 76 people, but then I'm grateful to my teachers.
So despite of being such a long days, you're still entering neuro anesthesia only. So I think you're very passionate about the subject.
Passionate about the subject, yes. Passionate about the teachers who taught me the subject, even more, yes.
Superb. So then, what is your future plan? Like after finishing your DM, you must have had a plan, no?
So as of now, anyway, I have a bond for 2 years. If I'm getting it, I'm talking as if it's already there. But then, getting into Vellore and then the bond of 2 years. And I'm sure by 2 years, the answer to the further plan will get charted. I am a very teaching, college teaching kind of a person. So I think the answer to that at the end of 2 years I should get. But I think that's an answer for 2 years later, sir. We'll do a podcast on that.
Yeah. We should do a podcast again. So, but I strongly recommend somebody in the academic and research field for the first 7 to 8 years. So basically your CV will build. In most of the other hospitals, what's happening is even though there are so many skilled people, the CVs are very weak. The CV should be strong, and along with the clinical work. If clinical work is, hard skills are the main pillar, along with it, CV also should be there. If both are balanced, then it will be very good. And you will be like international ready. And any country would want such kind of a person actually. So doing only clinical work and only not doing the academic side wouldn't actually make you a well-rounded anesthetist. So that is the main difference between the Western anesthetists and Indian anesthetists. And now actually we also actually pitched in the last decade a significant number of publications and academics, and then all this training program started. So we almost like, are touching their level now. And so guys like your generation, actually, if you focus more on becoming well-rounded by doing audits and research, and then making, you told checklist, no, checklist itself is a kind of an, a safety system. So these are the things the Western doctors adopted 2 decades before. And that is why, the systems are more, I don't call it more safer. There are more, even Indian safety is there. Yeah. more accountability and all that would start now. So I think this is a very good plan. If you get a job there, I think you should continue there for some more time.
See, sir.
Yeah. And then any suggestions or you want to give to the audience who are watching this video, who want to get a good rank like you in future in anesthesiology? What?
Theory doesn't help for these exams. I'm not an MCQ person at all. I'm far from MCQs. I can't do this option of ruling out. For me, it's concept and understanding patient, which is more important. So one thing that I learned from my parents, my mom was very clear saying, Ajay, there's one difference you probably need to do away from NEET PG and NEET SS is to do the MCQ books properly. So the MCQ books, the 3 standard books, that is Brian Hall, Lippincott, and the 1000 Reviews by Walter Kluwer, that is the Scherenbach book. Those 3 books are something that really made a difference to me because I did them twice, like all questions twice. Like first did them, then rubbed all the answers and then read them again, but doing them with the explanation. Because these fine points we really don't think of when we're doing the theory reading. That doesn't help. So these small fine points sometimes go aloof. So then I think doing those question banks helps bridge the deficiencies or the gaps in the system using the videos from Marrow, then use the question bank sincerely to sit and do them again and again and get them. I am sure that a lot of people told Brian Hall was probably a lot of questions bucket list for this NEET exam, but then direct lift-offs were also there. So then do the question banks properly because that really broadens the whole idea per se. So then bridge it with the videos and then do clinics right. Theater is our temple, so no cross questions on that.
Got it. So what you're saying is along with studying all these question banks and Marrow videos, you have to be strong in the clinical side also. That will help you in solving some of the. No, it's not about only sitting and reading the books and videos and all that. Correct? No? Got it. Superb. Then I think we have come to the end of the video. So thank you, Dr. Ajay, and good luck again. Good luck with the counseling, and we hope you get your dream destination college, and you'll become a very good neuroanesthesiologist in future and do a lot of good research and innovations in future.
Thanks a lot, sir. Thanks a lot. Means a lot to hear from you.
So we might collaborate in future in some projects.
I'll be happy.
Yeah. Okay then. Thank you then.
Thank you, sir.
Bye.
Thank you.
Bye.